Hello, everyone. My name is Margaret Vance. I am the Clinical Nurse Education Specialist at Pennsylvania Hospital, an entity of Penn Medicine for the operating room. And I'm really excited to tell you another tale from the bedside. You know, in some of my other videos that we've discussed, I really kind of brought up the importance of being able to communicate effectively and really escalate any patient safety concerns that you may have. And being new in the OR, I think that's one of the hardest things, is to feel comfortable enough to really stand up to people that may have vast amounts of experience as compared to you. But just remember that even though you're new and newer to this team, you still have valuable insight and you know what is best practice and being taught to you as you learn. So I was in a thoracotomy case. This was an open lung. I was scrubbed in at the time. I was getting relief from lunch, and I was getting relieved by two very senior members of the team. My circulator had vast amount of experience prior to me starting, and the person relieving me also had been on the team a long time. At that point, they were about to place mesh in, but they weren't quite there yet. So I went to lunch, and when I came back, they were starting to close on skin. So this time, naturally, we're performing our counts, and I say we're missing a lap sponge, and everyone kind of looked at me. No, we're not missing a sponge. I said, no, let's count again. I'm missing a sponge here. And again, I was kind of getting some pushback, almost as if, no, there's no way we would have left a sponge inside, Meg. There's no way. And I asked, well, did you do a cavity count before you placed the mesh in? And they said, no, we didn't, but we figured that was fine because we're going to be doing a count once we get to the first layer. At this point, we're now on skin. I'm still missing this lap sponge, and I keep saying, it's still missing. And so they're searching the trash, they're searching the ground, I'm searching the field, we're searching all over, still cannot find this lap sponge. So we have not closed, obviously. However, at this point, we call X-ray in, they come to take the flat plate, they get the picture, we put it up in the room, everyone looks, there is the sponge buried under the mesh that had been placed. Very small, I mean, it was so scrunched up, but you could see it clearly lighting up on the screen. The surgeon says, okay, it's under the mesh, had to reopen the incision a little bit more to be able to get that sponge out of there. But I'm very happy that I continued to push back and to advocate for my patient that was on the table, because if that patient had left the room and we did not follow proper protocol, or maybe my insistence just had been ignored, that sponge probably would have been left in that patient, and they would have had to come back to have that sponge removed again. So please do not feel that just because you are new that you don't have a voice, that you shouldn't speak up, that just because these people that you may be working with have a lot more experience than you, you are still a valuable member of this team. And being new to practice, you also have just this heightened awareness of what should be happening in those rooms. So please make sure that you listen to your voice, listen to your surgical conscience that's inside, right? And speak up, because that patient needs you to help protect them while they are under anesthesia. So I hope this was a helpful lesson for you. I hope that you find your voice very soon and feel comfortable enough to speak up to your peers and to surgeons and other members of the interprofessional team. You got this, your voice matters, and make sure you speak up for patient safety. Thank you so much, and I hope you learned a thing or two about being a new to practice OR nurse.